Spinal Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, here with Chris, audio-visual guru and common man. This week's show, we're talking about bursitis. And this should be an easy one. I could honestly get this show over in one sentence.
That's great, because I don't even know what bursitis is.
Perfect.
So yeah.
Here's your one sentence.
Okay.
It's not bursitis.
I had a feeling you were going to say something along those lines. But
It is so frustrating how many people get diagnosed with this, and it is almost never bursitis. So let's talk about what a bursa is, what bursitis is. Let's talk about what it actually is if it's irritated, and let's talk about what it never is when patients come in and say they have bursitis.
Do you think, okay, for me, not knowing what bursitis is, it sounds like one of those, it's not a common thing that most people self-prescribe to themselves,
No, I
self-diagnose.
think as you get older, you'll start to maybe self-prescribe bursitis more, but you're right.
Okay.
You're right. And there's a good point. It's almost always somebody telling you have bursitis.
That was kind of where I was going with
Right.
it. Is it one of those things where like, you have that, and you're like, I did? Okay.
Well, and it's very frustrating because a lot of doctors, so you'll go to the doctor and they'll do like a quick examination, and again, you're with your doctor, your primary, your ortho, 5 to 10 minutes, maybe.
Yeah.
Okay? Maybe they've done imaging and they've looked at the imaging, and most of the time the imaging, it's an x-ray. Okay? And from that 5 to 10 minute examination, from that x-ray, they'll tell you have bursitis. Here's the problem. Bursa isn't bone, it doesn't show up on x-ray.
So how are they just prescribed, or how are they diagnosing that?
Basically, you have pain in a certain area, they don't see telltale signs of something else, so they say bursitis.
So then why even go through all the rigmarole of doing the imaging?
Well, for most part, they shouldn't be doing the imaging in the first place. For x-rays, and we talked about this, like if you didn't have a trauma,
No
you
point.
pretty much shouldn't be having an x-ray.
So it's a matter of they're doing the imaging to rule out a sort of trauma. But
I mean, a trauma is like you fell,
Right.
like you were in a car accident, something snapped, right? Like.
Sure. But there's also the cases where you fell, you never did anything about it, years go by, and actually something had happened and you ignored it.
Could have. I mean, they're rare, but
sure.
could have. And even then, if that's the case, it's healed by then.
Right, so what are you going to do about it?
What are you going to do about it? Yeah. But I have so many people that come in and say, yeah, my doctor did an x-ray, I have bursitis. And you're like, no.
The x-ray's
Wrong.
not a part of this.
Bursa is soft
algorithm,
tissue.
yeah.
You cannot see it on x-ray. The x-ray can kind of allude to it. You could see some like grayish in the area, but that's it.
So I'm dealing with some medical stuff with my mom, and it's whispered down the lane of the doctor communicating to either my dad or my brother, to them, to me. And the amount of questions I have and the amount of non-answers they have, but are accepting whatever's happening, is concerning, but also common.
Very common.
So a doctor tells you something, you don't really understand it, you're only with them for 5 minutes, you leave the room, you never talk to them again for the most part. People are asking you, you have something, you're like, oh, he said I have a bursa, I don't really understand what any of it means,
right.
But that's what I picked out of that.
I've had many people have surgery, shoulder surgery, hip surgery, back surgery, spine surgery.
Yeah.
And when they come in post-surgery for rehab, I say, what did you have done? They say, I don't know. You're like, okay.
Yeah, I mean, I understand it because you're paying and you're supposed to accept the fact that this is an expert in their field and they're telling you you need this and you just want to be better, so this is a solution.
Yeah, and I think we have started to, or for a while we've been shifting this. In the 50s, the doctor's word was gospel, right?
Yeah.
And now it's probably more question than it's ever been.
Yeah.
But that being said, I'm still surprised on how many people, whatever their doctor says, that's what they not only accept, but they inherit of themselves. Like they say like, okay, the doctor said this, and this is me now. Doctor said I have fibromyalgia, I am fibromyalgia. The doctor says I have a meniscus tear, I am a meniscus tear. Like I can't do this because of my meniscus tear.
I don't want to get political or anything like that, but there is definitely maybe one, you want an answer, but two, you kind of like being the victim or having some sort of thing like that. 3, yes, I agree that everything is questioned more nowadays, some things still aren't questioned. So I don't know where it's all a big concoction here of misinformation, misunderstanding, misdiagnosed.
And now mistrust.
Yeah. And so all that being said, it's not freaking bursa.
It's not bursitis. So
not bursitis,
a bursa is a fluid-filled sac, and you have them all throughout your body.
Okay.
The common locations are your shoulder, your elbow, your hip, your knee, and behind your heel. Okay.
Oh, so it's all over your body.
You have them right now.
So if you have bursitis,
You
it
are
could be...
riddled with bursas right now.
Oh my God.
Yeah. So, and again, so a lot of people don't understand that when they say, like, I have bursitis. Like, okay, it's a itis, an inflammation of a bursa. Okay? A bursa is a fluid-filled sac that basically acts like counter friction or minimizing friction between the muscle, tendon, and the bone. To make it simple.
So it doesn't rub against
So it doesn't
the bone.
rub against it, yeah. So if you pictured like a rope on the edge of a rock going back and forth,
Right.
eventually that rope's going to fray.
Right.
The bursa is in between the two, keeping it from doing that.
Got you. So in theory, even if you have bursitis, it should be a temporary thing.
Should be temporary, and the treatment is primarily rest anti-inflammatories, and I actually agree with that. So again, if you listen to the show and stuff like that, I'm all very spine.
Yeah.
If it is true bursitis, if I had elbow bursitis, I would want the doctor to drain it and inject it with cortisone. Okay, that's the best treatment.
And
then some rest, maybe some ice,
when you say drain it, you mean drain the bursa sac?
Drain the bursa sac.
Does it regenerate its fluids?
It actually does. One treatment for chronic bursitis is a bursectomy.
Okay.
So you go in and surgically resect it, the bursa actually grows back.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So the bursa is regenerative.
All right. Good thing vasectomies aren't the same way. That is actually really interesting. So, how many people have you've seen or dealt with over the years who said, "I've had bursitis for years"?
A lot.
And so that's complete.
That's crap.
Yeah.
100% crap.
The police don't even want to hear it.
They're upset.
That information is Okay. That's so a flag to you right away if someone comes in and says, "I have bursitis."
I was actually thinking about this, like what real number I would put on it.
Yeah.
99.7.
All
so
right.
997 times out of 1,000,
1,000.
it is not bursitis.
But say they have bursitis in their shoulder. That's what they come to you with. It's actually a problem somewhere else.
Probably a problem in their neck. Well, and this is my different viewpoint, right? And this is the viewpoint that I think a lot of people should adopt, and it should be at least explored early. All right, the bursa is innervated by your spine. If the bursa is irritated, inflamed, why?
Okay.
One easy explanation is that there was a nerve issue not really getting there and causing that bursa. So the subacromial bursa, the shoulder bursa.
Yeah.
All right. That's innervated by the C5, C6 area of your spine.
Okay.
Same area that innervates your rotator cuff. So
Okay.
if the rotator cuff isn't functioning and the bursa is now getting more pressed on, because the rotator cuff is supposed to basically create space in your shoulder, it makes your shoulder operate optimally, right?
Okay.
That's not happening. Now the bursa is getting pressed on, and the bursa isn't getting as much signal. So the bursa needs signal in order to survive, function, right? Bursa is not getting as much signal. Now it makes sense why the bursa got irritated in the first place. So the bursitis, even if it is bursitis, is very likely it's just a symptom, not a cause.
So could you have chronic bursitis?
Yeah.
Because you keep having a neck problem?
You keep having a neck problem, and then you keep getting bursitis over and over and over again. Yeah, 100%.
Okay, so the way you would treat a bursitis is to get the inflammation down.
Well, if it's like true bursitis. So you ever watch Billy Madison?
Of course.
All right. if it's true bursitis, so if somebody's like, I have elbow bursitis, and you go, you don't have elbow bursitis, and you look at it and you go, go! Like, you should see it. It should look like a goiter in the elbow.
Oh,
right?
wow, really?
Like I mean, it is, for the most part, you look at it and you're like, oh yeah, you got
visually
bursitis.
noticeable.
Visually noticeable. So if it is bursitis, it's typically red, swollen, irritated, puffy. It hurts to touch that area. It hurts to lay or put pressure on that area. And it almost never travels. Okay, so if you have knee bursitis and it's going down your shin or down into your foot, that's not bursitis. If you have shoulder bursitis and it's going into your hand, that's not bursitis. Now, theoretically, an inflamed bursa could push on a nerve and cause some of those symptoms. That is just so super rare, okay? If you have symptoms on both sides, it is never bursitis. My right shoulder bursa can't cross to my left side, okay?
Okay.
So it's giving this to the people out there, like if you have any of those symptoms, you probably don't have bursitis. Okay. And despite that, it's going to get diagnosed as bursitis. Now, if it is true bursitis, and again, if I had true bursitis, I would want it drained and shot with cortisone.
So, true bursitis, how do you get true bursitis?
If you look it up, there's a bunch of different causes. So it's the main maybe 4 causes. One would be repetitive stress. So you know how we talked about that rope rubbing on the rock? Mm-hmm. Well, if the rope's rubbing on the bursa in between the rope and the rock, it could piss off the bursa. Okay. So repetitive chronic stress. The other one is trauma. You could get, so let's just say the hip. If you land on your hip, or like football, you get tackled and you hit into the hip. The elbow, there's actually, it's kind of like a bar, you pass out at the bar, sitting at the bar, right? You're drunk. You pass out sitting at the bar and you're putting pressure on your elbow. That's trauma to the bursa.
Ah, okay.
Another one's infection.
Okay.
So the bursa can actually become infected. It'd be like septic bursitis is what they call it.
Okay.
All right. And then there was definitely a 4th one. I mean, it's always then idiopathic. So meaning like, I don't know why, it just kind of came out of nowhere.
So if someone comes in, says they have bursitis, what do you do?
I immediately think they're wrong.
Sure.
So I do what I always do, right? Mm-hmm. If let's say you have elbow bursitis, I look at your elbow, I ask you questions about your elbow. I see how far you can bend your elbow and straighten your elbow, and if we can reproduce your bursitis-like pain.
Yeah.
Okay, because nobody gives a shit if they have bursitis if they don't have any symptoms.
Yeah.
Right? So we're trying to reproduce your symptoms, whatever those symptoms are, whatever you have attributed to your bursitis. Okay? Then when I'm done with that, then I look at the area of your spine that could have caused those symptoms. So for your elbow, I would look at that like anywhere from, if it's the outside of your elbow, C5, C6, if it's the inside of your elbow, T1, T2. So basically your mid-neck to your upper back. I'm looking at that area and I'm seeing if it's immobile, if it's tender, and if it is, I mobilize it or I show you how to mobilize it, and then we retest out your symptoms and we see if they've changed. And we're talking 997 times out of 1,000, that's the case.
So what if somebody goes to their doctor and gets diagnosed with bursitis?
Their doctor will most likely inject them.
Okay.
Yeah, and then probably send them to physical therapy. I'd say that's common, but here's the kicker for that, right? Let's say you have true bursitis. If you're coming to me, so I'm an expert orthopedic physical therapist. I have 16 plus years experience. If you're coming to me with true bursitis, in my head I'm thinking, what the fuck are you doing here?
Yeah.
Right? Like it's an inflamed bursa. It needs rest. It needs anti-inflammatories. It needs injected. Like theoretically, you can stretch and strengthen the structures around that area so it's not putting as much pressure on the bursa. But if the bursa is inflamed, no matter what you do to try to stretch, so like if I have a knee bursitis, right, and it's because the quad tendon's pushing on the bursa, and I want to stretch the quad tendon so that way it's not chronically pushing on the bursa. If I stretch the quad tendon, I'm pushing it onto the bursa.
Yeah, and you're gonna,
right?
Yeah.
Let's say the quad is theoretically weak, and I need to strengthen it in order for it to not put as much pressure on that area. If I strengthen my quad, I'm putting pressure on the bursa. Even stuff like Graston or taping, like it really doesn't work and it still would kind of irritate that area. So if it's true bursitis and your doctor sends you to physical therapy, which is very, very common, what are they supposed to do for you?
Nothing.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
Yeah, they basically just kind of manage your symptoms.
So how do you get to that point where it's so commonly misdiagnosed?
I have no idea.
Okay.
Yeah, I don't know.
Is it now one of those catch-all labels as opposed to what it actually is?
You know what? That's probably a good rationale for it. Like, you know, the doctor looked at it. They didn't find any obvious. So let's just say for your shoulder, they didn't find any obvious signs of a tear. Meaning like you didn't have gross weakness or like the telltale signs of like a rotator cuff tear. They did an image, they didn't see any fracture. They maybe saw something that alluded to inflammation or swelling. So they're like, bursitis. It's a nice catch-all. It explains some of the symptoms.
It provides an answer to the patient.
Provides an answer. It's treatable, and the treatment for a lot of the treatment they'll provide or offer, not that one that I agree with, for most like rotator cuff pathology, for bone spurs, for bursitis, is a cortisone injection.
Which would take the pain away temporarily.
Which takes the pain away temporarily for all of those things. So you've temporarily been cured, right?
6 months.
And I'm holding up quotes.
Yeah, and 6 months down the road, your bursitis acts up again.
Less. Most of the time, cortisone injection, the effects have worn off within 4 weeks.
But that specialist and that whole rigmarole you went through that took 6 months to get that injection in the first place, now you have to restart all that again.
Now you restart all that. It's probably a little bit quicker because they've already told you that.
Yeah.
Well, and you really they'll give those injections about every 3 months, every 3 to 4 months.
But
most of the time, it's only 3 to 1 area in a year.
But now you're probably on the regular schedule of getting those.
Of getting the injections, yeah. Until they're like, you know what, you keep having this, so we're going to do surgery.
Which then, what happens if they do surgery on your bursitis?
Well, it's rare, and most of the time they're doing that and something else.
Gotcha.
So they're doing some rotator cuff repair, and they also do a bursectomy during that, or they do they're doing a bone spur removal, and they do a bursectomy during that. Like it's rare in isolation, but it happens. But if it is just a true like removal of the bursa, I mean, you're just sore from the surgery, from somebody cutting you open, but there's really nothing. There's no structural changes, so you're pretty much good to go.
So would that pain return in that area?
I mean, it definitely will because it wasn't bursitis in the first place. So.
There you go.
Right. So let's say it was true bursitis and they remove the bursa grows back. Will the pain return? I don't know the numbers on it. Yes, it happens. I don't know what percentage. I don't know what percentage the pain comes back or doesn't.
Gotcha. So what we've learned here today is that it's not bursitis.
Yeah.
If you've been diagnosed with bursitis, perhaps get a second opinion and maybe have someone look at your neck and back.
Yeah, the problem is that most people out there don't do it well. Like when you say look at your neck and back, you're going to say, all right, well, then I get an image to my spine. Well, imaging is more flawed and misleading than most people realize.
Right.
Then you'll say like, well, who do I go see to do what I do, right? And one of the people out there that are maybe the best are physical therapists that have a McKenzie certification. So they do something similar, but it's still not quite the same. You could say a chiropractor, and a chiropractor, if you kind of blended the two together, and that's kind of what I am. I'm Maitland certified. Maitland does a lot of joint manipulations and stuff like that. So just for common term, you can say Maitland is like a chiropractor in his approach. He'll mobilize and crack your back and stuff like that. McKenzie, they'll show you how to move your spine in certain directions. Okay, I kind of blended the two together. And then the final thing is that once you've mobilized the joint, once you've shown the patient how to mobilize themselves and gain range of motion in a certain area. Then you need to show them how to strengthen in that range in order to stay better, in order to keep them in that range. And nobody really does that. Chiropractors, a big knock against them is they really don't do anything to keep you better. They go in, you get your hot pack ultrasound massage, you get that little activator to you, they use a Theragun, they crack your back and you're out. Physical therapists, they don't do enough of that, and they do a lot of strengthening, but they even do like core neutral strengthening, and I hate that stuff. Like, it just doesn't work. So who do you go to?
I would go to Dr. Caleb Slater at Spinal Truth.
I mean, that's the answer we were looking for all along.
Yeah, I mean, honestly, yeah.
It is frustrating, though. I really do think like I have a very logical and linear way of thinking of a lot of problems, and not just what the symptoms are, but where they're coming from, the underlying cause. And it makes sense. You need mobility and stability. You need range of motion. You need strength in that range. That shouldn't really be refuted, right?
No, it makes sense.
And if your bursa is irritated and you didn't have trauma and you don't really know why, a good explanation is that the nerve that's getting to the shoulder is causing the shoulder to operate suboptimally. And if that is causing more pressure on the bursa, and maybe the bursa itself is getting less innervation, that leads to an irritation of the bursa. That just makes sense to me.
Is there similar things that could be irritated that would cause similar pain in the same areas of the bursa sacs?
Yeah, 100%.
Okay, so you could even be misdiagnosed from that.
Yeah, so let's say subacromial bursitis, like you can have an AC sprain, so your acromioclavicular joint sprain. You can have a bone spur, you can have rotator cuff tendonitis, tendinosis, tendinopathy. You could have a labral tear. So all of those have they have a decent amount of overlap in their presentation.
Okay.
And the pain is all in the same area.
Same area, so, okay, that makes sense.
Yeah.
All right, well, it's not bursitis, guys.
It's not bursitis. So if you've been told you have shoulder, elbow, hip, knee, or ankle bursitis, retrocalcaneal bursitis for the PTs out there, you do not have that. At least, or 3 out of 1,000 times, you have that. The other 997 times, you were wrongly diagnosed, and there's better treatment out there, treatment that actually works, that doesn't rely on medication, and looks for the underlying cause.
Yeah, don't get those bursectomies. Consider the vasectomies.
Vasectomy over bursectomy.
That's
Vasectomy good, bursectomy bad.
That's what I've heard.
All right, that's our show this week. Hopefully we answered some of your questions about bursa, bursitis, bursectomy, and even a little about vasectomies. Our next week's show
Is a great question.
is a great question. If you have that same question, stay tuned for that next week's
You want
show.
me to look real quick?
I don't know.
Okay.
We will be here talking about stuff.
All right.
And it'll likely be medical adjacent.
That's right. All right.